Hey, welcome back, guys. I've had a couple questions on or regarding some pain with front rack position. And what these two questions specifically were asking, both of them told me, hey, you know what? I'm getting some discomfort or some pain along the outside of the lower arm. And for some of them, almost some numbing type sensation all the way to the pinky. They would get in that front rack position. They're like, man, it's just kind of painful along this side here. Well, typically that's due to our ulnar nerve. And in the front rack position, the ulnar nerve does get put on some tension or some stretch. So if we have some what I'll call adverse neural dynamics or ability for that nerve to slide through that system, if it's not sliding as well as it should, it can cause some irritation. It can be very uncomfortable and really can also just give the sensation of I'm stiff or too tight to get in that position. But sometimes it's that ulnar nerve telling you, hey, you know what? We're being put on stretch here. We're going to cause this reaction of you tighten up a little bit so you don't take me too far. It's typically not a big deal. There are some good ways to start addressing it. Now, to actually do some nerve testing, I usually recommend let's get a trained clinician, a PT, or someone else to really test that out for you. But if you just wanted to start to do some gentle nerve gliding to see if you can loosen it up and see if that helps, here's a great way to do it. What you're going to do, so if our treatment arm is this right arm here, you're going to take your hand, you're going to open it up, we're going to turn palm down, pull it back, and you're going to bring it up almost like you're trying to put a ear muff or ear cover on the ear. So that's the direction we're going with that arm. With the other hand, you're going to be holding down this shoulder girdle as close to the neck as possible, kind of over that clavicle and shoulder blade. So we're compressed or holding that down here. We're going through that motion. Once I even get to here, I already start to feel some of that nerve tightening and symptoms. So you want to go to where you start to feel that, and here we got a couple options. First option is when we hit to where I can barely feel it, we're going to be rocking just the head back and forth. Everything else stays stationary. So we're sliding that nerve system from the neck down through that arm. Okay, so that's one way to glide it. The other way is just stretching it from the opposite end. So we're going to get in that same position. Right there is where I start to feel it. I might keep the head rocked away a little bit so it's tensioned on that end. And then I'm just going to bend the wrist back, release, bend the wrist back, and release. You want to find that point when you're doing these movements like a light switch. I can turn it on. As soon as I release it just a little bit, it turns off where those symptoms go away. And that's the spot we're hanging out. We're going slowly into it, slowly out of it. We're not being over aggressive. I can't caution you enough. When we're messing with nerves and we're putting on tension, if you're cranking things too hard over and over, maybe not till the next day, but you'll probably regret it because you'll get pretty sore. Sometimes that nerve can get really fired up. So you want to be careful with that. You just want to bump into it. Hey, I can turn it on gently and I can just as easily turn it off. Turn it on, turn it off. Usually with that, what I tell people, 10 gentle reps, in and out, turn it on and off. Come out of that position. Don't do more than 2 or 3 rounds with that. But give that a try if you feel like you're dealing with some of those symptoms or it's affecting that front rack position. Give that nerve glide stretch a try and see if that helps improve it overall.